This is by far the single greatest law enforcement issue we're dealing with on a statewide level, on a countrywide level, and perhaps the single biggest public health issue we're dealing with across the United States at this moment, and perhaps ever. If I had to pick one word to describe what we're contending with, it would be unprecedented. I think this epidemic is unprecedented in its scope and in its reach. If we put it into perspective, the CDC, the Centers for Disease Control, in 2016 compiled data on overdose deaths in the United States. And the number they came up with was 65,000. 65,000 drug overdose deaths in the United States. And they estimated that 66%, or 2/3, of those deaths were related to heroin and opioid overdoses. The 2017 numbers just came out last month. And according to those numbers, 72,000 people have died in the United States from drug-related overdoses. And again, they estimate between 2/3 and perhaps even higher, because it takes some time for the data to catch up and to be verified, that 2/3 of those 72,000 deaths at least were related to heroin and opioid abuse. And if we put that into historical context, if we look at other epidemics in our nation's history and other crises and other events, I think it really drives home what we're dealing with this crisis in particular. During the 2 decades of the Vietnam War, we lost 58,000 Americans. So in 1 year to drug overdoses and heroin and opioid overdoses, we've lost more people than we lost in the 2 decades of the Vietnam War. If we look at other causes of accidental death in this country, in 1972, when car accidents peaked, we lost 55,000 people in this country. Again, the numbers from this particular crisis dwarf those numbers. If we look at the AIDS crisis, the HIV/AIDS crisis in the mid-90s, we lost somewhere around 43,000 people. And so on and so forth. I think you get the point that what we're dealing with is incredibly unprecedented. We have never seen sheer number of death from an accidental cause like this before. And I think, from my perspective as Attorney General now, and as a county prosecutor before that, what we have to do is develop a similarly unprecedented response. One that is a collaborative response that forces us out of our lanes and comfort zones and brings together law enforcement and public health officials, and in this case today, entertainers and insurers and educators, to come up with different ways, creative ways, to respond to this crisis. Because that's what it's going to take if we really want to put an end to the rise in these numbers, because I'm sorry to tell you that they are rising. And I'm sorry to tell you that New Jersey is not immune from those national numbers that I just shared with you. And so let me just share with you what we're doing at the Attorney General's office, what we view as our unprecedented response to this particular crisis. It starts with prevention. For us, it really does start with prevention. And prevention starts with drawing the stigma from the disease of drug addiction. And I think that's a big leap that we in law enforcement had to take, that we are not dealing with a law enforcement issue, that we are dealing with the disease, and that we can't lock away a disease, that we have to come up with treatment options, we have to come up with prevention options. And so on the prevention side, we're using data, and some of this data we're releasing today. And the data is meant to show people in this state that this crisis touches everyone in this state, that you should start having these preventative discussions with your family members, with your loved ones, with your children at an early age. And that data, that some of which we're releasing today on our website, njcares.gov, will show you year by year the toll that this crisis has taken on New Jersey and that it is currently taking on this state. If you look at those numbers, you will see that of those 65,000 deaths that I talked about in 2016, 2,221 of those took place in New Jersey. You will see that of those 72,000 deaths that happened nationally from drug overdoses, that 2,750 took place in 2017 in New Jersey. And then if you extrapolate that data, which will show on a county-by-county level and will show at a granular level, you'll see that 6 people a day died from drug overdoses in New Jersey in 2016, 7 people died from drug overdoses in New Jersey in 2017, and then you'll see the real-time data for this year, and you'll see that 8 people a day are dying now in New Jersey from drug-related overdoses. And we'll show you on a per capita level that while the numbers might seem low in Atlantic County and some of our less populated counties, that on a per capita level that more people are dying in those counties, even though Essex and Camden are being hit particularly hard by this particular crisis at this moment. And we'll show you that the number of deaths don't even tell the complete picture, because we'll also be sharing in near real time the use of Narcan, which is the overdose reversal drug that law enforcement and EMS and ER doctors will administer to revive people if they can catch them at the right moment to bring them back to life. And the data that we have and we're able to share is just the EMS and the law enforcement data. And you'll see that over 9,000 administrations of Narcan have happened this year alone. And then you'll see in 2017, we had 14,000. So the pace of the Narcan administrations, the pace of death is increasing in this state. And the reason for that is that the heroin that we're dealing with here in New Jersey, is among the most powerful heroin in the United States. And that's a distinction we should not be proud of, but that's a reality that we have to deal with from a law enforcement perspective. We have some of the purest heroin in powder form that unscrupulous drug dealers are now mixing with other powerful synthetic opioids like fentanyl, which is 50 times in some cases more powerful than heroin. And the reason they're doing that is because fentanyl is cheaper and it allows drug dealers to expand their profits. And so you have folks who are not chemists cutting these powerful drugs, a small amount of which would be lethal to any one of us in this room, into heroin, which is being dealt on the streets of some of our major cities. So that's the constant challenge that we're dealing with, and those numbers continue to go up. So clearly the fear of death is not stopping users from using. And so the reason we share these numbers is to prompt a discussion among folks in this room, that you could take these numbers and look at it and say, yes, it is a problem in my county. Yes, it is a problem in Bergen, in Essex, in Somerset, in all of our counties. It literally is a problem, as the play suggests, in any town. In any town. It doesn't discriminate between rich, poor, educated, uneducated, professional, unprofessional, people who are working class to the people who are working in boardrooms. It touches everyone, literally. And so I think that sharing of data to prompt that discussion is an important first step in our prevention efforts.